Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take action to try and do something about it to make better systems for all of us. Today we're going to talk about children. Before we do, let me point out that in the YouTube description box you'll find a link to the Healthcare Advocacy newsletter that is the source and the text for today's video. I recommend it highly because it has lots of visuals, lots of graphs that sort of make the points by themselves. It's a little better than just description. We will have an action at the end, and I'll put that in the YouTube description box as well. Of course, you can share, like, and subscribe, and of course, subscribe to the Healthcare Advocacy newsletter for free and get emails every day with this kind of stuff. Let's talk about it. This is more of a research description than it is local news on medical issues. We've all been bombarded about how many people in the country want abortion made illegal because children and families come first. This harkens back to the mid to late 1800s when there was a decline in the birth of white Protestant babies. That's actually where the anti-abortion movement comes from, is from that. Anyway, I was scrolling through my email a couple days ago, and I came across some U.S. government data on birth rate in the U.S., and I was amazed to find that it has declined pretty dramatically for the last 25 years. There are a few ups and downs, but largely the trend is down. And if you look in the newsletter, you'll see a graph of that. The data that I use comes from a nonprofit called usafacts.org. I highly recommend them to you. They slice and dice U.S. government provided data, so it's understandable to lay people like us. If you look at the graph, you'll see it is births per 1,000 people from 1980 to 2021, and it gets pretty low. It heads down to around 10 or so, after having some highs up around the 16s. Anyway, so I looked at it and I wondered, how does this relate to prosperity? Because in my mind, what occurred to me is, oh, well, if people are prosperous, they'll have lots of kids. So a good measure of prosperity is what's called median household income, and we should look at that over time. Half of the households above the median, half below. Well, I provide that plot for you down below, and it tends to increase over time. And of course, the data comes from usafacts.gov, and I put a link to it there for you. But I can show you with my fingers kind of what it looks like. Birth rate goes down, prosperity goes up. It's going the wrong way. So there's something wrong, at least wrong with my thinking. So I needed to look at the data a little more and say, what's going on? The answer is, why don't people have children? Well, people don't have children when it's not kind of made easy for them to do it. Now, in the U.S., it is actually fairly hard for people to have children. Let me do a comparison for you. There are a number of issues that make having children a little bit easier. So, and here's what they are. Having a safe place to live, having access to health care, the parents or caregivers or whoever should have meaningful paid time off from work when the child arrives, and meaningful paid time off for sick leave if the child is sick. You should have affordable child care, sufficient food, don't forget that, access to education. It sounds like a lot of stuff, doesn't it? Well, let's see what our industrialized partners in Europe do. And I put in a link to a European Commission source, because on March 24th, 2021, after consulting with key stakeholders, including children, the European Commission adopted a proposal for the entire European Council, and it recommended establishing a European child guarantee along with the supporting staff as a working document. The Council adopted the proposed recommendation 3 months after it was proposed, which is like record time. Good luck getting anything out of Congress in that time. Anyway, the objective of the European Child Guarantee is to prevent and combat social exclusion by guaranteeing effective access of children in need to a set of key services, and they identify them. Listen, free early childhood education and care, like daycare, free education, including school-based activities, and at least one healthy meal every school day, free health care, healthy nutrition, adequate housing. Sounds familiar, huh? While most children in the EU already have access to those services, inclusive and truly universal access is vital for ensuring equal opportunities for all children in Europe, and in particular to those who experience social exclusion due to poverty or other forms of disadvantage. So let's see, how does the U.S. stand on these things? Well, we're unable to extend the child tax credit thanks to Republican senators who blocked bringing it up for a vote last week. There is no guaranteed health care for children. Only the most impoverished can get it through CHIPS, which is the Childhood Health Insurance Program, which is Medicaid. And of course, millions of children lost Medicaid due to Medicaid unwinding after the pandemic. Nice going. SNAP, food stamps, and WIC, Women, Infants, and Children, provide some nutritional support, but only for the most very impoverished people. Adequate housing. Okay, this is a sore point with me, and I'm going to tell you why. The stockpile of government-supported housing has been dwindling over the last 30 or 40 years. But more than that, the minimum wage is still $7.25, and it has been for the last 13 years. And that the average rent in the U.S. has increased 36%, listen to this, from 2010 to 2020, about $390 a month, an average of about 3.18% a year. But in 2022, rent went up by another 16%. Honestly, it's no wonder the number of homeless families is just on the rise. We have no mandatory paid leave from work when the child is born, and certainly we don't have mandatory paid sick leave. In most places, if it exists at all, it's limited to maybe a month. What does the world recommend? UNICEF, whose business is looking after kids, they recommend 6 months for family leave when the child is born. So let's look. No paid sick leave for all employees. This is just so critical. Anyway, one more point about the sick leave. Let me make this really clear. In addition to parents taking off when the child is born, children develop an immune system, of course, by meeting other children and getting exposed to all kinds of things, and then they bring it home. And you know what? They need to be taken care of, because this is how they build a healthy immune system over their lives. And if we're not taking care of the parents so that they can stay home and take care of the kids, we are shortchanging everybody. So what's the long and the short of this sorrowful story? It's that while many in this country say they cherish family values, I call bullshit. If they did, they would walk the walk instead of just talking the talk. And we would have all the same type of policies that our peers in Europe have. Let's let our elected representatives, we know that taking action on this is in their wheelhouse. Let's let our member of Congress and our senators know we want meaningful action to actually make this country child-friendly, not child-hostile. That includes health care, housing, regular meals, preschool and school, income supports that help families. Down in the YouTube description box, I'll put a link to a site where you can get the phone number or email of your elected representatives, or take the short way out, which I recommend, and use ResistBot on your cell phone. Just send a text message to 50409, and here's the message. Sign, S-I-G-N, space, PZNYUB. That's sign, S-I-G-N, space, PZNYUB. I'll read you the message. I'm your constituent, and I want you to know that birth rate in the U.S. is in a general decline, largely because this country is not amenable to having children. We offer no significant paid time off, excuse me, when children are born or sick. We do not have universal preschool or assistance with daycare, which is extremely expensive. Go check it out if you haven't looked lately. There are no significant guarantees of income supports for families with children. In fact, the Republicans in the Senate just refused to discuss restoring the improved child tax credit. Minimum wage lags behind rental increases by about 45% since 2010. Support for better child nutrition and housing is also significantly lacking, and there is no guarantee of health care for children. It is a big list: housing, food, health care, preschool, family leave, sufficient income. But if you want children born here, then you have to make sure that this country makes it safe for families to have children. I expect you, my elected representatives, to address each and every one of these issues publicly and when you vote. And I want you to know I'm watching. That's what I've got for you today. Down below, you can like, share, and subscribe. Send me a comment. Send me research topics you'd like, or send them to healthcareadvocacy1, all one word, @gmail.com. Thanks. Have a good evening.